Welcome to DC2B Revolution, helping chiropractic students think big in order to live large. I'm your host, Noah Volz, and today I'm here with Dr. Todd Riddle. He's Director of Rehabilitation at Texas Chiropractic College. And in addition to that, he's lead instructor for Functional and Kinetic Treatment with Rehabilitation, Faktr, and Dynamic Tape. Dr. Todd, thanks so much for being here.
Yeah, I love it. Thank you. Thanks for having me.
Pleasure. And so, when I was doing a little bit of research on you, I came across one of your websites, and you had this great tagline where it said, "You're a rebel, a mad scientist, a pioneer, and you're pushing the boundaries of the status quo." So I wanted to know what that means. Like, what makes you all of those things?
Yeah, well, to be fair, I have to kind of give a little bit of shout out to the people that kind of came before me. So, without those foundations and that platform, obviously I wouldn't have that to stand on. So it definitely wasn't me alone, but a little bit of backstory. Obviously you just mentioned I'm affiliated with Faktr. There are a lot of people that had their hands into this, two in particular, Dr. Tom Hyde and Dr. Greg Dorr, that were the co-founders of Faktr. And long story short, they found that when you take something like traditional IASTM and you add movement to it, they got accelerated outcomes. So that, in a very brief nutshell, is kind of where it got its start with Faktr. So where I get to be a little bit of a mad scientist, or a little bit of a rebel, so to speak, is we take that amazing platform that they created, and we've been just having a lot of fun testing out new stuff with it. Recently, we added in the BioMechanical tape called Dynamic Tape. We had have a partnership with another company called Motion Guidance, which is a laser guided exercise system. So what we're doing is taking your traditional IASTM courses and just kind of throwing them on their ear and really trying to make it more of a system as opposed to a technique. Because if you're focused strictly on techniques, that's all you've got. But if you develop or work on a system, now it's not technique centric. It becomes, well, if that really doesn't work, pun intended, then I've got other things that I can look to help accelerate outcomes for a patient. So it's just my way of kind of taking something that people have known about for a long time and having some fun with it, just kind of plugging things into it to see what works and trying to be as evidence informed about that as possible.
Yeah, I love that. And I think that's so important. When I initially came to chiropractic school, I was writing for the paper. And one of the things I came across was empiricist, like the philosophy behind empiricism. Often, back in the day in Greece, they were considered the quacks. They were considered the ones, selling the, what people didn't actually want. But the empiricists are the ones, like you're saying, they're just the people that they have a hypothesis, they test it, they see if it works. They have another one, they see if it works, and they're constantly testing their assumptions and constantly seeing if there's a better way or another way or another intervention that is going to get better results so that they can apply that. And with all you're doing with rehab, it seems that you have your hands into a lot of the biomechanical assessment and treatment. And so, as a student, what do you think is kind of unique to the lens that you look through towards biomechanical assessment and treatment?
Yeah, so I'm so passionate about that side of what we do. I had a patient the other day that reminded me of this, and I put it on my social media that, patients don't lie about what's wrong with them. Sometimes they just forget. They don't know how to articulate it to you. But one of the windows into what's going on with a patient is the way that they move. And if you can make them move, they can't lie about how that feels. They can't lie about how that looks, especially if you know how to take those movements and have them perform them in a controlled manner. So I absolutely think that it's a vital patient care program to get a better idea of exactly what's going on with them without actually having to ask them questions. And what I find is when you take them through a movement assessment, it actually stimulates more questions that you may not have thought to ask or didn't even know you should have asked when you first started your examination. So I just love the information that you get from it. I know that some of these assessments fall under scrutiny for their validity. And I don't try to use them from an injury prevention standpoint, but I do get a great baseline about what's going on with them at that time. And if there's something from that information I can glean to improve their outcomes, then that's what I'm going to use it for. It's merely fact finding.
Yeah, I think that fact finding is such an important tool. I definitely, being at school, I'm kind of feeling this transition from more traditional orthopedic exams, neurological exams, to more kind of functional movement assessment type things, because not everybody has a clinical diagnosis, but they still are in pain. There's still a decrease in function. So, what are you seeing in kind of the performance in rehab world that's really exciting and really kind of moving in that direction towards validating functional assessment?
Yeah, well, see, there's a couple of different directions I would want to go with this. That it's not just about the rehab program itself, because if you're thinking that everything that you're doing for that patient is strictly from a pathoanatomical standpoint, we're missing a much larger picture. So before I go any further with the biomechanical assessment, I think it is worth mentioning that we are treating people, we're not treating conditions. And each one of those people come to us with a different background, with a different life, a different social engagement. So there's having to look at them as a whole person. So I do want to make it clear that as part of my assessment and the ones that I teach is that, yeah, we're going to look at the biomechanical side, but we also have to look at what's going on in their life that may be driving this problem, because this may not be a biomechanical issue at all. It could be that, their mother just died, or, they lost their job, or, something awful has happened and it's really changed their psychological well-being. So I do think it's important to bring that up. But as far as the biomechanical side of this goes, you'd be hard-pressed to find many practitioners, especially ones that are learning in school, that haven't heard of the FMS or the SFMA or versions of that. So I think it's really great that a lot more students are picking up on this and using either those tools or versions of them to get a better idea of what's going on with patients. And that's not to say that your neuro testing isn't useful and that orthopedic testing isn't useful in certain circumstances. But if we're depending upon just those as the definitive reason for us calling something a diagnosis, then again, I think we're missing a much bigger clinical picture. So, I said that it's all about fact finding. And when you use your assessment, your movement assessment with possibly orthopedic testing, with neuro testing, with a psychological evaluation, we get a much better rounded picture of what we're dealing with that patient. And quite frankly, it makes it much more individualized.
Yeah, completely. And I love how you said, it's patient-centric instead of symptom-centric or pain-centric or condition-centric, that you're gathering all of those pieces of information to paint as complete of a picture as you can of that particular individual and the struggles that they experience, and then figuring out, what tools you can utilize to, improve where they're at. So, in terms of your clinical practice, what tools do you utilize, and how can students kind of glean from your expertise tools?
Yeah, so obviously I'm a bit biased, so I very heavily use the Faktr protocol within my own clinical practice. But I have kind of a non-traditional practice, and I'm very blessed to have that. Working at Texas Chiropractic College, they've basically afforded me the opportunity to work with a lot of other great clinicians on the chiropractic side, and I get to focus very heavily on the rehab side. So there is very much a dedicated team approach to how patients get managed. So I get to really kind of work in my sweet spot, which is rehab. So from that standpoint, again, I'm very oriented, but that's not to say that that's the only stuff that I use. But you know, so the tools that we use obviously would be the stuff from the Faktr protocol, the motion guides. Have to encourage students to take a look at another product that we really love called dynamic tape, which if you look at the spectrum of tapes, on one end you've got your kinesiology tapes and the other end you've got your rigid tapes. Well, this one kind of falls right there in the middle. So it's not to say that it's better than other tapes, that it's got it's got a different category for what we apply it to. So from a rehab standpoint, I get to focus strictly on the pathoanatomical and the biomechanical. So my entire job is to get somebody out of pain from a rehab standpoint as quickly as possible, but then improve function as quickly as possible well. So whether that's using instruments, or whether that's using cups to do myofascial decompression, or hands-on approach, or exercise. I mean, we cannot disregard just how important just movement in general is, which I think is probably one of the biggest selling points for Faktr, how quickly we try to integrate motion into what we do with our soft tissue work. So I wish I could say that I have this magical bullet for that one thing that works. You know, anybody that's been in practice long enough, and you know that there is no one thing that works the best, and to have a wide variety of things hanging from your tool belt is going to benefit you so much more than being technique oriented.
Yeah, and especially for your patients, right? I mean, if you're a one trick pony and you only do one thing, then, you know, and that thing doesn't work for your patients, then it's you know, it's much harder. But if you have a lot of tools, and like like you've done, really refine this one tool so that you really, you know, mastered it and have been able to offer that to a large number of people, and really like refine the nuances of that. I mean, I think that's remarkable, and I think that's what we're all striving is finding out where our unique niche is, or our unique path, and then embracing that. Can you just talk briefly, kind of, you know, so to speak, your origin story? Like, how did you kind of move into Faktr, and then, you know, how did you know you were home once you got there?
Yeah, so that's kind of funny, and this is where the story gets a little bit weird for some folks, is that I'm actually a graduate of Sherman College. So when you try to reconcile my rehab background with ending up at a more philosophically oriented school, you know, it kind of makes people's heads explode. But no, initially my background started off in what I was hoping for was physical therapy, but I had a football scholarship that kind of made that difficult. So I ended up in something relatively similar to physical therapy called kinesiotherapy. And after I graduated from the University of Toledo, I worked in a rehab clinic at the university for a little bit of time, and realized that really wasn't the direction I wanted to go, at least in that environment. I started off as an aquatic therapist. And then I kind of threw myself headlong into doing sports performance along with rehabilitation. So that's kind of the background. But at that time, I was working in Charlotte, North Carolina, and the closest school to me was Sherman. And I'd gotten to the school, I kind of realized that this was something a little more than I bargained for, but decided to stick it out. And truth be told, it was really one of the better decisions I made in that regard. It opened up a lot of doors. You know, you look back and you go, wow, had I not done this thing and this thing and this thing, I wouldn't be where I am today. And I definitely think that going there had actually played a part of that, because it allowed me to start a physiotherapy program at the school at that time that they didn't have, which introduced me to a lot of different people. And one of those people was Dr. Hyde, in kind of a roundabout fashion. And, you know, sports people, we just kind of gel. We know people that are good people when we see them. And, you know, Tom was definitely that guy for me. He ended up becoming my mentor and one of my most favorite chiropractors on earth. so we just kind of gelled and hit it off. And I'd asked him if at any point he needed instructors for Faktr, and he said, yeah, absolutely. So long story short, here I am, still involved. And my wife has kind of since taken over that side of Faktr, but you know, it's very much a family affair. But I wouldn't be sitting here had it not been for that connection to Sherman, which it's weird, but it is what it is, and I embrace it.
Yeah, I mean, we never know, right? We never know where the path is going to lead. In hindsight is always 20/20. So when you look back, it makes total sense. But you know, as it was happening, it probably felt a little bit strange. You know, I know that there's so much more that students are going to want to know about you, know about Faktr, about dynamic tape. Where is the best place for people to kind of see what you're up to, learn more about you, that sort of thing?
Yeah, there's actually quite a few different places. The easiest place to gather more information about either one of those courses or several other ones would be at sports-seminars.com. Okay, that's kind of the warehouse for all of the courses, including Faktr and dynamic tape. There's another one called Faktr-store.com, where if they're interested in seeing some of the products associated with both the Faktr class as well as the dynamic tape course. But there's also a way, we have a directory on there that you can look up to see if there are Faktr providers in your area, so that if you're interested in going and shadowing a Faktr provider and seeing how they're incorporating some of it into their office, that's a nice way to learn without my bias or learn without another instructor's bias. So I'm all about challenging biases, and I'll be the first to tell you I try to do that on a regular basis. So I think the best way to see how it gets incorporated is to go see how somebody actually uses it in their office. And truth be told, if they've taken that course within the last 5 years, there's a strong chance that we've got new things in that course that they probably haven't even seen yet. So that's going back to your initial question, you know, how does that make me a rebel or a mad scientist? Is because I don't settle for the status quo. I'm always looking for the next thing to improve student learning, to improve patient outcomes, and to just really generate an overall valuable experience for everybody that touches our products.
Yeah, thank you for that. And thank you for, you know, questioning the status quo and continuing to up-level your experience so that you can share more of your experience with students. I know that you have a lot of generous discounts for students, so I definitely recommend that they check out what you're doing and take advantage of those while they're still in school. You know, if they feel that Faktr really calls to them or the dynamic tape really calls to them. So thanks so much for being on the show and sharing your experience and sharing your you know, knowledge and wisdom. Really appreciate having you on.
Really enjoyed it. And if I could just kind of dovetail to what you were saying, I think it's so important for students right now to just soak up as much information as they can for two reasons. You'll be better off when you leave, but also a lot of courses like to give discounts to get students. We realize, especially those of us that are really truly about education, you guys are the grassroots, like you are the next generation, and it's easier for us to make the lasting change we want to see by getting to students early on, as opposed to waiting till they're out in practice and life has taken over and finances have taken over, and there's just 100 different things to get in the way. So get as much as you can in now, because it'll definitely make you much more competitive when you get out into the marketplace. So I think you made a great point there.
Yeah, I think of it as kind of that metaphor of the tree or the sapling, right? If you know, get to the students when it's a small sapling, it's easy to, you know, influence it. Whereas once you've already grown up, you know, 10 years into practice, you're always this huge tree, like chopping down all those biases and then trying to start over again is going to take a lot more time. So yeah, I think that's perfect. This has been a production of DC to Be Revolution, helping chiropractic students think big in order to live large. Please, if you enjoyed this video, subscribe to the channel, like the video, leave some comments in the comment section below and let us know your experience with Faktr and how it's helped you or those in your circle of community. And thank you once again, Dr. Todd Riddle, for being here.
Thank you. Appreciate it.